A woman has been charged in Cheshire for 8 murders and 10 attempted murders. This woman was supposed to be somebody that actually helped people and people's families and babies in hospital to get well and better. And they employed this woman that killed their family. I mean, it's heartbreaking as it is as the world going on as it is with people are dying of coronavirus and any other illnesses in the world, like cancer and AIDS and multiple sclerosis. People die of memory loss, and they got news of this woman here. So this guy's going to be speaking about a woman. Let's have a look here now. So what we need to do is
Internet Machine now has the latest from outside the Countess of Chester Hospital.
This has been a long and a complex investigation, one which is quite unusual and very rare as well. It goes back to May 2017 when Cheshire Police investigated the deaths of 15 babies within a year at the neonatal unit here at this hospital in Chester. And then that probe was later extended to 17 baby deaths and 16 collapses between March 2015 and July 2016. Yesterday, 30-year-old Lucy Letby was arrested.
This is the woman that's killed people's babies in Cheshire. Supposed to be working for the NHS when she does that. Sickening.
With the attempted murder of 10 babies and the murder of 8 babies. Cheshire Police has said that the parents of all those babies have been kept up to date with the situation and they are being supported by officers here in Cheshire. But clearly this has been a distressful investigation, one which has taken a long time as well. And tomorrow, 30-year-old Lucy Letby, who was a nurse here at the Countess Chester Hospital, will be in Warrington Magistrates Court where she'll face those charges.
Police have arrested a man after a car ploughed into a police station in Edmonton in North London. Video footage shows a man pouring liquid onto a road outside the police station before setting it alight. Moments later, officers tackle him to the ground. Officers remain on the scene and no injuries have been reported. Let's return to the virus pandemic now, the human cost of COVID-19. Every person lost has left a mark. And so many others have also suffered during 2 national lockdowns. Our home editor Jason Farrell spoke to some of those bereaved in Sunderland.
We've come to Sunderland's Stadium of Light because it's hard to visualise the magnitude of what has happened. There's no crash site, no ground zero. But in the course of 9 months, 50,000 people have lost their lives to COVID-19. Enough to fill every chair in this stadium, and 1,000 more.
This microscopic killer has terrorised us. It's taken loved ones before their time. It's disrupted our daily lives so profoundly, we rarely get a moment to reflect on the scale of what's happened, that each of these seats and more is an empty chair in someone's home.
The stadium stands in a city that's had a high case rate. South Tyneside and Sunderland's NHS Trust has reported over 400 deaths. Fiona Anderson was one. 48 years old, her family say she contracted the virus doing what she loved, nursing. Her father was also infected and hospitalised, but he recovered and was discharged the day before Fiona died. Her sister Sarah says the loss is immeasurable.
For us, she died in service. She was working for the health service. She was working on behalf of her country. It's been 6 months now, and I still feel frustrated by everything and by what's going on in the world. But I don't think I'll ever come to terms to the loss of my sister.
Deaths among under 40s have been rare, but still in the hundreds. Teenagers and even younger are among them. But it's the elderly and those with existing health problems who've had years of their lives stolen. 76-year-old Sylvia Griffiths died in a Sunderland care home. Her daughter Deborah believes the size of the UK's death toll could have been avoided.
It shouldn't have happened. It shouldn't have got to 50,000. We were starting to get this under control with the lockdown, and here we are yet again.
What do you think went wrong?
There's various things went wrong. Lack of PPE, the government guidance wasn't clear. I think people were confused. 111, the testing system, the track and trace, which clearly hasn't worked as it was supposed to do.
We pass this dreadful milestone in a week that has given hope that we may soon have a vaccine, and these seats.
He always keeps saying that we should have a vaccine.
And we can celebrate life.
Jason Farrell, Sky News.
So we heard the story of Sylvia Griffiths there, who died at the age of 76. And in fact, 3/4 of those who've died with COVID-19 were her age or older. The disease has affected people to a different extent depending on many factors, as our correspondent Roland Manthorpe explains.
How did we get to 50,000 deaths? The simple answer is with shocking speed in 1 month in April. This chart shows the number of deaths by day, and you can see on 24th of March, when we locked down, there were roughly 150 deaths a day. Over the next 16 days, there were 10,000 deaths, rising as high as 1,000 deaths a day at the peak. By the time the shops reopened here in June, there had been 40,000 deaths, almost as many people as were killed in the Blitz during the Second World War. There have now been around 8,000 total deaths in this spike. Add those together, and that, very simply, is the tale of the pandemic. But of course there's more. We can look inside this data to see not just when people died, but where. Care homes were notoriously dangerous during the first wave of the pandemic, but it really is stunning to see just how many people died there, this light blue colour. Almost as many as in hospitals, the dark blue colour, at the peak. We can also look at who died. Age was such a crucial factor. Look at these light blue bars here. That is over 85s. And this dark blue one is 75 to 84. Under 40s, this green and gold bit down here, really accounted for very few deaths, relatively speaking. And that's stayed the same right throughout, even though we know those groups have had a lot more cases recently. Pre-existing conditions were also incredibly important. Most people who died had a pre-existing condition. That is these light blue boxes here. Although, interestingly, that was less common among younger people. We don't fully understand that, as with so many things. Speaking of which, this is data on deaths and ethnicity for the peak of the pandemic. There's quite a lot of uncertainty in this data, but what is incredibly clear is that non-white people have died at a far greater rate than white people, whether their heritage is Bangladeshi, Black African, Black Caribbean, Chinese. That applies right across. White people are here at the bottom. So we know when, and we know roughly who, but of course the question we're all asking is why. Looking back at this data, it's hard not to see the lockdown in March as the crucial moment. At that moment, every day counted, yet we delayed. It's terrible to think that even locking down a week earlier could have saved many thousands of lives.
Rather Manthorpe there. Stay with us on Sky News. We'll have the sport next with Nick Powell, and England manager Gareth Southgate gives his reaction after Greg Clark's resignation as chairman of the Football Association.
Well, guys and girls, hope you all enjoyed that. Give it a like, give it a comment. I know it's very sad news what that woman's done to them children. It's horrible, but there's a lot more sick people out there like that, unfortunately, and we just wish them sick people didn't get them jobs or be in our areas that we are in. What I mean by that is we all deserve to live on the earth. Some people would say good or bad, but we always make mistakes, but we can always change ourselves, is what I'm trying to say. But anyway, thanks for joining me. Hope you all enjoyed the video, and it's very sickening in some ways in this video with this woman doing that to them children. Horrifying. Anyway, thanks for joining me. Peace.